Yeah, so I think, it's the dynamic or ongoing underwriting is a concept that has existed in the life insurance world for a long time. It's just, I guess, the technology has never been there for it to be successfully implemented. And I think historically, from the days of when HIV/AIDS first came out, and they had the products where you obviously were tested up front, and then every 5 years you had to be tested again to confirm that you remained HIV negative. I remember that was a complete and utter disaster, because I think if 5% of people went for the retesting, that was a lot. So, but I think you're right. As technology has advanced and made it far more accessible and hopefully more cost affordable at the same time, then it opens up a whole lot of new avenues, which we might have considered before, but haven't really been able to implement. And I guess it's not just a life insurance thing. I would assume it would apply at least as equally, if not more so, to the health insurance, medical aid space in South Africa as well.
Definitely the health side. We're seeing it in health insurance. We're also seeing interest in these technologies by occupational health as well, health and safety. Just making sure your employee corps, they are healthy, and simple things. Just carrying 5 to 15 kilograms of extra weight, that does is correlated with absenteeism. People are more absent if they're not healthy. People are not as productive if they're not healthy. So there's a very wide interest. But obviously in health insurance, which is way more dynamic in the claim side of things, this also becomes interesting, because let's take, for example, your GP prescribes a hypertensive medication or a statin or something, then these technologies can potentially be used to track whether someone's still compliant or whether that medicine's actually working. Let's say you do a month-to-month scan to see, is this person's blood pressure still in check? Now, there's two reasons why that can not be in check if it's not in check. The one being that they're not using their meds. The second be that the meds are not doing what it should. And in both those cases, there's at least action that can be taken. And I think for that, the health insurance payers are quite interested.